only blind date where you know you're going to meet the love of your life. But how? In how much time? Whether it's going to be a smooth or a bumpy ride, that is for you to experience. Each pregnancy is unique and so is each labor journey, and both as unique as the baby they produce. With changing times, our questions and topics about various situations change. Like today, everything is revolving around the COVID pandemic. But one question that always remains unchanged: is normal delivery better or is C-section better? What is safer for my baby? What is better for me? Well, better is a relative term. Under normal circumstances, for sure, a normal delivery is better. But if you or your baby's life is in danger and your labor has gone too long, or your baby will not fit out of you the usual way, a C-section is better. It ensures the safety of mom and baby. You may deliver vaginally or by a cesarean. Both take equal amount of strength and courage. Vaginal delivery is the birth of the baby through the birth canal. It is the way it is meant to be. It usually involves a quicker recovery and shorter hospital stay. Also, as the baby passes through the birth canal, the germs and microbes in the vagina of the mother are passed on to the baby, boosting their immunity system and giving them the much required strength to live outside the protected womb. During the process of being pushed out from the vagina, the baby expels the water that is filled in the lungs, and it ensures a normal breathing and less respiratory problems. But every coin has two sides, and normal delivery has its dark face too. In some mothers, it can cause damage to the perineal area and can cause loss of control over their urine and motion. The vaginal area is the most sensitive area of the body, and hence some mothers can complain of pain and sensitivity days and months after they have already delivered. Sometimes the baby's heartbeat starts to fall and can cause complications to the baby. That's where C-section comes to the rescue. It is usually a life-saving procedure and is done to save the mom and baby in such circumstances. Sometimes you could know in advance that you're going to have a C-section. 1, if you're having a twin pregnancy. 2, if your baby is too large and your pelvic bone is too small to let the baby go through. 3, if you have infections which could be transmitted to the baby as the baby is passing through the birth canal, like HIV, AIDS or herpes. 4, if your baby is head up, bottoms down. Number 5, if you have anything obstructing the mouth of your womb, not allowing the baby to come down, like a placenta being low-lying or having a fibroid in the uterus. If you've had a first cesarean, it does not mean that you're going to have the same on the second time. But yes, there are limitations, and we can talk about that in another video. A C-section in older times and now. Today, a C-section has advanced tremendously to become much safer, much more comfortable, with lesser stay in the hospital than before, and neat scars which are hidden in your bikini line rather than the long vertical scars which used to cut through the whole of your abdomen in yesteryears. But then, obviously, a normal delivery is always the first choice. And if you fear pain, don't. Because nowadays we have a number of pain relief methods, like we have the deep breathing during the yoga, we have an epidural analgesia, which is an injection in the back, we have the laughing gas, which is like an instrument for pain relief. It will make your ride smooth and comfortable. Most of you moms have your heart set on having a natural or vaginal delivery, and the news that your baby needs to be delivered by a C-section could be disappointing. The vision of pushing your baby out like you always dreamed can sometimes be replaced by worries about the surgery, by worries about a longer hospital stay, by worries about a tougher recovery period, not to forget the scar. But remember, the best birth is a safe birth. A birth that takes place by an appropriately chosen method of delivery, and a birth that brings a healthy baby into the world and into the arms of a healthy mother, is the flawless end to your 9 memorable months and a super amazing beginning to your cherished motherhood. For many more dilemmas revolving around women, for anything gynecological or related to pregnancy and periods, subscribe to this stream of endless Gyno Gyan. Thank you.